Hi. Earlier in the year I made some videos about coronavirus and where it might take us. Anyway, this is the last week of September. It seems to have taken us into a bit of a mess. Anyway, this video looks at how we got where we are and the possible ways out. But essentially, it looks at the mess we're in. When a new infectious disease appears, it quickly spreads through the population as no one has had it before, and their immune systems have not developed antibodies to combat it. The vulnerable may be killed or seriously harmed, but most people recover. As more and more people are infected, produce antibodies and recover, there are fewer and fewer people for the virus to infect. And as they tend to be spread amongst the population, the virus finds it more and more difficult to locate new people to infect, and it fades away. It doesn't disappear. It's skulking, and will occasionally find a non-immune person to infect. When this state has been reached, the population is said to have herd immunity. And I covered this in more detail in April in the following video, and there's a link to it there. All infectious diseases follow this pattern. With some diseases, unfortunately, whilst moving towards herd immunity, many of the population die, or they're left with long-term serious health issues. I mean, people of a certain vintage like me will remember well polio, the killer and paralyser in our midst. Reaching herd immunity is the only way of combating infectious diseases, and there are two ways of achieving it. The first, number one, by being infected with a full-blown disease and producing antibodies naturally. And the second way is by being given a vaccine, which induces the body to produce the antibodies without the risk of death or long-term health issues. Vaccines are difficult to produce, have to be rigorously tested to ensure there are no serious side effects, and this can take years. Viruses also have a tendency to mutate, rendering a vaccine ineffective. I mean, we haven't yet discovered a vaccine for the common flu after decades of research. And we have to reinvent the flu vaccine almost every year to combat the new strains. Let's look at this COVID-19, this coronavirus, which is dominating our lives just now. This is a new variant of the group of coronaviruses, and it first appeared in China at the turn of the year. Like most countries, we in the UK had become complacent and were ill-prepared for what was to come. It quickly became obvious from events in Italy that this wasn't your average flu, which kills about 20,000 a year in the UK. It was more serious. The UK strategy, which had been in place since 2016, was useless when confronted with a pandemic. And the protective material in storage, it was insufficient, it was ineffective, and much of it was out of date. And one of the reasons for our complacency was that the forecasts of massive death tolls predicted in previous epidemics, SARS and I think AIDS was another one, and MERS, made, as it turns out by the same lot who forecast 500,000 deaths in the current pandemic, they failed to materialise. So we just became a bit smug about our preparations. There are three ways of dealing with outbreaks such as COVID-19. Number one, do nothing and let it rampage through the population. The advantage of this is that herd immunity is reached quickly and life gets back to normal. The downsides are that many may die or suffer long-term consequences, and the health service would be overwhelmed, resulting in deaths of people who might otherwise have been saved. The second is to mitigate the consequences of the disease by advising the population of the dangers and how to avoid them. This would rely on the common sense of individuals to assess the risks to themselves given their particular circumstances, and those putting others at risk by not complying with the advice would be pressured to comply by the rest of the population or by the people. Now, the advantage of mitigation is that it is unlikely that there would be a second wave. Now, the downsides are that if a large number choose to ignore the advice, the health service would be overwhelmed, causing unnecessary deaths. And of course, anything other than doing nothing would also delay the time taken to reach herd immunity. Mitigation relies on the confidence the authorities have in the common sense of the population to take responsibility for their own health. And this was a strategy which Sweden adopted, and at the time it was very controversial. And the third way is to suppress the population by introducing rules enforceable by law with financial penalties to ensure compliance. Now, this would minimise the flood of infections. It would flatten the curve you would get if you didn't do anything. And in doing so, it would reduce the risk of the health services being overwhelmed. I mean, as it was, the United Kingdom health services, although they were severely stretched, they weren't overwhelmed as such. We can tell that by the Nightingale hospitals, which were very, very quickly erected. They've never been used. In early March, the United Kingdom adopted the mitigation strategy. But a report published by Imperial College London on the 16th of March suggested that doing nothing could result in 500,000 deaths, and even with mitigation could still result in 250,000 deaths. On Friday the 20th of March, on hearing these numbers, the government panicked. It did an immediate U-turn and adopted the suppression strategy. Glad to say that. On Tuesday the 25th of March, the coronavirus bill, with sweeping powers, unknown outside wartime, was rushed into law. There was no debate, despite the concerns of many eminent scientists about the Imperial College mathematical model. Hospitals were cleared of thousands of non-urgent cases, many of them carrying COVID-19, for which they hadn't been tested. They carried it back into their communities. Many of them were elderly patients from care homes to which they were returned. It was a disaster, as a disease rampaged through the care home sector. And it was exacerbated by the movement of care home workers. They moved from care home to care home. Some of them were part-time. There was lack of training, lack of vigilance, and a lack of personal protection equipment, PPE. Routine operations and diagnostic tests were cancelled. Waiting times for routine surgery, which were already by far the worst in comparable countries, are now years long. Dentists have closed except for emergency treatment, which of course means extraction. There's no way you're going to get a filling. On the 21st of March, schools were closed indefinitely. And on the 24th of March, lockdown was applied. The severe restrictions, especially on travelling and gathering in social or work groups, I mean, they do reduce the rate of spread of the disease, but there's a high price to pay, both financial and social. I mean, businesses are going bust, workforces are being slashed, family visits are curtailed, numbers of foreign tourists, I mean, they've fallen off a cliff. Foreign holidays have been off, then on, then off, a bit like the okey-cokey. The trust between the police and public, which was already poor, it's been eroded even further. Funeral and wedding numbers have been curtailed. I mean, the cancellation of school exams was an utter disaster. And I'm sure you can think of other examples. To mitigate the effect on businesses, the government introduced the furlough scheme, which is due to end on the October the 31st, but it's just been announced today, the 24th of September, that it is to be extended for a further 6 months. It's cost billions of pounds, and seemingly subject to a great deal of fraud. The fear induced in the population by the media, the government and certain advisers has dissuaded people with symptoms of serious illness from visiting their doctor or hospital for a diagnosis or treatment. I mean, many have died, or they're dying, who would have been saved otherwise. The numbers of these excess deaths is shameful. Those problems apart, there is a major problem with the suppression strategy. There comes a time when restrictions have to be eased, as in the very popular Eat to Help Out initiative, when people pile into pubs and restaurants. Because lockdown has restricted the spread of COVID-19 virus, there are still large numbers in the population who still do not have immunity. And our skulking virus seized its opportunity. And not surprisingly, we have a second wave of cases. I mean, anybody who didn't see this coming was blind. From the 14th of September, group size was limited to 6. with fines starting at £200 rising to £3,200 for persistent offenders. There was no suggestion that it had to be the same 6 each time. I mean, an infected person might meet with a number of groups of 6, infecting some in each group, who then might go on and infect others in other groups of 6. It's utter nonsense. I mean, you know of lots of other examples of queuing for supermarkets without your mask and having to go at the shop with your mask and so on. There are lots of them. This week, that's September the 22nd, the figure of 50,000 cases a day with 200 deaths within a month was bandied about by one expert. But others suggested that it was a worst case scenario, as was the 500,000 deaths forecast on the 16th of March by the Imperial College Group. And they suggest that the figure is going to be nothing like as large as that. Nevertheless, on the 22nd of September, we had a second stringent set of regulations imposed on us, with financial penalties starting at £200 for failing to wear a face mask and £10,000 for businesses failing to obey COVID rules, and for individuals failing to self-isolate having returned from abroad or having been in contact with an infected person. I mean, how they trace these people, I have no idea. There will be tens of thousands of them. Other restrictions which had been eased were back with a vengeance, with the threat of a second lockdown if we didn't toe the line. Ticking off. I mean, snoopers are encouraged to shop their neighbours. I mean, what are we coming to? And the army are taking on some police duties to release the police for COVID-19 patrols. Draconian is the word which I see frequently being used. I mean, Draco, he was a Greek tyrant. He used to write rules in blood. These regulations will have to be lifted sometime, and we will get a third wave, followed by more regulations, and so on. That's the problem with the suppression strategy. There's no end to it. When does it finish? Meanwhile, the costs mount and the fear continues. Unemployment continues to rise or increase. More businesses go bust. People with underlying health conditions still more reluctant to visit the doctor or hospital until it's too late. And excess deaths rise, an increase in mental health issues and domestic abuse increase, etc. So there comes a time when the costs outweigh the health risks. And there are an increasing number of people who say that we passed that point some time ago. Anyway, let's have a look at some statistics, namely graphs, before I get too bored. And these are the stats for Sweden, which went down the mitigation road. These are the daily new cases in Sweden from the beginning of February until this week, the 22nd of September. You can see the curve there. A big peak in June. And this is a graph for daily deaths in Sweden. And they had a very high peak in April, which I'll mention in a moment. But the thing to notice is that from July, the number of deaths has remained remarkably low. There's been no increase at all. And similarly, on the daily new cases in Sweden, you can see that from July there has been no second wave. The number of cases has remained constant and low. So in April they had a large spike in the number of cases and deaths, as, like we in the UK, they failed to see the effect on the elderly in care homes. And that's where the vast number of deaths were. Since then, the numbers have fallen dramatically, with single-figure deaths each day since the end of July. I think since the end of July there's only been about 40 deaths in Sweden. There was no lockdown. You didn't have to wear a mask here, there and everywhere. The economy is still in good shape. Schools weren't closed. Bars and restaurants remained open. And the only restriction was that group size was limited to 500. Not 6. Note. The authorities' faith and trust in the people to stick to the mitigation strategy, it paid off. The people listened and took heed of the advice. And for them, the worst is over. So let's look at the United Kingdom. These are the daily new cases, and again you can see that big peak in April, much the same as Sweden. And then we had lockdown, and the number of cases gradually got less and less and less. But of course, as soon as you ease lockdown in some way, because of the large numbers of non-immune people in the population, people who haven't had the disease, they start catching it. And you can see there that from the end of August into September, the numbers have begun to increase in quite a dramatic way. I think the total number of cases today was 6,000 on the 24th of September. But let's look at the numbers of deaths. See how this second wave has affected the number of deaths. So this graph looks at the numbers of deaths, and the thing to notice is, again, since July, the numbers have been remarkably small. And even with the increase, a dramatic increase, in the numbers of cases in September, again, the numbers of deaths hasn't increased by a significant amount, although no doubt it will increase more than is indicated there. But it will still stay low. So we can see that in the first wave, the number of deaths mirrored the number of cases. In other words, big peak for cases, big peak for deaths. But in the second wave, we can see that the number of deaths is very small, despite the increase in number of cases. I mean, there have been less than 40 a day since July the 16th. I mean, it's probably worth mentioning at this point that ordinary winter flu, it kills about 400 a day between October and January, just to get this 40 a day into perspective. So why, although you've got a big increase in number of cases, has the number of deaths not mirrored that? And the evidence would suggest that the second wave infections are mainly in the younger age groups, who've been more likely to ignore the regulations, and where deaths are rare in healthy individuals. I mean, there will be some hospital admissions, and there will be some deaths in vulnerable groups, but there is greater protection for them in the light of what happened in the first wave, and hospitals will be able to cope easily. I mean, the number of intensive care beds which are unoccupied is substantial. So where does that leave us? Well, we seem to be ruled by a small cabal. There's no debate in Parliament, and we, the people, through our elected local or national representatives, we don't have any say in this. The experts cannot agree. I mean, their opinions cover a complete spectrum. The country faces ruin. There's an unimaginable debt which will have to be repaid sometime. Unemployment is set to go through the roof. I mean, there's no exit strategy. It could go on for another year. A second wave, we've got more regulations. If we lift the second wave, we get a third wave and more regulations. And if we lift that, we get a fourth wave and more regulations. I mean, when does it end? The powers that be are pinning their hopes on a vaccine to get them out of this situation. Without it, they're stuffed. And unfortunately, so are many others. Businesses, jobs, whatever. Herd immunity, and I'm sorry I keep coming back to this, is being pushed further and further into the future. But without a vaccine, that's the only way this is going to end. At some time, someone is going to have to decide when the costs are just way too much. Remove the restrictions and let our skulking virus take us towards herd immunity unhindered. There would have to be thorough vigilance to protect those who cannot protect themselves, and the common sense of others to take responsibility for their own health. This week, Boris Johnson flatly refused to consider this. Given the low number of deaths in the second wave, is that time now? Well, you can make up your own mind. Well, that's what I make of it. What do you make of it? Anyway, see you again. Oh, enjoy your Christmas. Take care. Bye-bye.